I'm Taylor Reimer, and I'm going to be giving medication via mini bag. So I already reviewed the physician's orders and compared it to the MAR, and I've got my medication from the Pyxis. So I'm going to wash my hands. All right, so I'll do my first check now. The patient is Venancio Vines, August 1st, 1963. No known allergies. The medication is Zithromax, 400 milligrams. This is a 500 milligram vial, so I can get my dose from this vial. IV, this says IV on the vial. Daily, it's October 22nd at 08:30, so I can give this dose. And I'll check the expiry date to make sure this vial is not expired. Now I'll look at the PDM. So it's zithromycin, also known as Zithromax. It's an antibiotic, may be administered by a nurse or student nurse, so I can give this medication. The usual dose is 500 milligrams IV daily, and the maximum single dose is 500 milligrams, so this falls under the maximum single dose. I'm going to reconstitute with 4.8 mLs of sterile water for a final concentration of 100 milligrams per ml, and I'm going to dilute my dose in 250 to 500 mLs of normal saline or D5W and administer over an hour. So I have 250 mLs of normal saline here because they are already getting a primary infusion of normal saline, and I chose 250 as opposed to 500 mLs because they're already getting fluid through a primary infusion. It's compatible with D5W and normal saline, so I know that it's compatible with the primary infusion. And potential hazards or side effects is nausea, vomiting, diarrhea. Okay, so I'm going to wash my hands now to prepare my medication. I have my vial of sterile water, and I'm going to swab the top of my vials. So I'm going to swab for 30 seconds and allow to dry. And I'll swab this one for 30 seconds and allow to dry. Now I'll grab my 10 ml syringe and my blunt fill. And I'm going to get 4.8 mLs of sterile water. Swoop and scoop, and I'll get the bubbles out. Okay, so I have 4.8 mLs of sterile water here, and I'm going to put it into my vial. So this has already been swabbed. And I'll allow some air to come out.
And then the compatibility is compatible with normal saline.
Okay, I'm going to rotate my vial to reconstitute, and I'll make sure that there's no powder in the vial. Okay, so according to my calculations, my dose is 400 milligrams and the concentration is 100 milligrams per ml, so I need 4 mLs of medication, and this is my calculation. So I'm going to get 4 mLs of my medication. I'll swab the top of the vial one more time for 30 seconds and allow it to dry. And I'll get 4 mLs.
And then we're going to grab our make sure that
so what we have is daily is 50 ml, it's not expired, and so I'm using 50 ml because I just don't want to
making sure that these are sterile,
and I'm infusing it over 60 minutes because I just want to not infuse it rapidly, so it's safer for the patient.
We're going to be
Okay, so I have 4 mLs of my medication here. And now I'll do my second check. So I have Venancio Vines, Zithromax 400 milligrams. According to my calculation, I need 4 mLs of medication for that dose, and I have 4 mLs here in my syringe. IV, I verified it can be given IV on the PDM and the vial. Daily, it's October 22nd at 08:30, so I can give this dose. Okay, I have my 250 ml bag of normal saline. It's not expired, and now I can instill the medication in. So I'm gonna swab the port on the mini bag for 30 seconds and allow it to dry.
So I have 2 mLs of sterile water here.
And I'm going to instill my medication
So swab it for 30 seconds.
without perforating the edges of the bag. So this will go in the sharps container. I'm going to gently mix the medication and attach my label.
And then now we're just going to gently roll it and mix it.
Patient Mancio Vines,
So to get our
drug
dose, which is
Zithromax.
I calculated it to be 8.8.
The dose is 400 milligrams. Volume of 4 mLs for a total volume of 254 mLs. It's October 22nd, 2020 at 08:30. Signature TRUMSN3. Alright, and I'm just going to put the rate on the other side. I'm going to run this over an hour, so 254 mLs per hour. This is my label.
I'm gonna try my best to get rid of the bubbles here, but
And I'll attach it to my bag.
I've been used, so it's harder to get rid of them.
Okay, so I've got all my supplies here and I'm gonna go into the room. So I'll wash my hands. Hi, I'm Taylor. I'm a student nurse. I'll be giving you your medication today. Can I just take a look at your wristband? Can you tell me your full name and date of birth, please? Venancio Vines, August 1st, 1963, August 1st, 1963. Okay, thank you. And do you have any allergies? No allergies? Okay, thank you. Alright, so I'll just make sure that the primary infusion is running well at the rate of 25 mLs an hour, so that's correct according to the physician's order. The bag and the tubing are labeled, and there's no peaks or bubbles in the tubing right now. So I'm also going to assess the IV site to make sure there's no irritation there. So I'm looking for infiltration, like swelling, cool, tight skin, and there's none of that, and phlebitis, so irritation at the site, pain, warmth, any infection like that. So do you have any pain there? No? Okay. So there's no IV irritation there. And I've done my entrance safety check. So now I'm going to do my third med check. Venancio Vines, Zithromax, 400 milligrams, IV, this is an IV mini bag, daily. It's October 22nd, 2020 at 08:30, so I can give this dose. Okay. So, Mr. Vines, this medication, Zithromax, is an antibiotic for your cellulitis infection. It's going to try to heal up that infection for you. So, you might have side effects like diarrhea, nausea, and abdominal pain. So, I would also explain to the patient their right to refuse the medication, and they have not refused the medication, so I can move forward with the administration. So, I'll wash my hands and I'll set up my equipment. I'm going to lower the primary bag.
Put this in the shots container.
And so now I'm just gonna do my second dose.
Then we're just going to just mix this evenly. Alright, and prior to this, I already got my med label first. So this is my med label.
Make sure this clamp is closed,
Do not cover.
and I'll spike my mini bag, keeping everything sterile.
We are going to go to the patient's room, grab our supplies. So I have my
And you definitely have 3 milliliters in our
Okay, and now I'll swab the port above the clamp on the primary tubing so that I can attach my secondary tubing.
and it's not open.
So I'm going to swab for 30 seconds
We're going to go to
and allow it to dry.
So we see again.
Keep it sterile so that I can attach my
And
tubing.
not an instrument, but it's a flow specific to the best with the disease. So I'm going to introduce
Okay.
how many.
Now I'll do a back prime. So I'll lower the secondary bag below the primary.
Checking your wristband.
and make sure there's no bubbles in the tubing. And I'll make sure my drip chamber is a third to a half full.
Do you have any allergies?
Okay, now I'll program my secondary.
Doing my third check.
I have my rate of 254 mLs an hour. Volume to be infused is 254 mLs. I'm going to program a callback, and I'll confirm my secondary. Select yes for callback. Okay, and now I can press start. I'll open the clamp. Make sure I'm watching for at least 3 drops in the drip chamber. I'm going to label my secondary tubing with date, time, and initials. I'll make sure there's no clean at the IV site. No bubbles or cleans in the tubing. I'm going to put the bed in the lowest position, call bell within reach. I will document on the MAR 0830 TRUMSN3. I'll also document on the intake and output sheet to verify that they're getting a secondary infusion. And in about 10 minutes, I'll come back and assess the IV site, make sure there's no side effects or irritation. And in an hour, when the infusion is done running, I'm going to come and program a 15 cc flush in the tubing. Thank you.